Isolation, anxiety, fear, we all feel it during the pandemic, but we're learning more about just how severely it's impacting the mental health of our nation's teenagers. ABC's Karen Travers shares with us one family's story.
Elle was in 6th grade when the COVID-19 pandemic began. Like millions of kids, their life was turned upside down.
As the weeks went on doing remote learning, I lost many things that I thought I'd never lose. That's when I really started to go into my state of depression.
Elle, who identifies as non-binary, says they were already having a tough time with friendships, but the disruptions and isolation of the pandemic made things worse.
This is not me just being moody and sad. It's much more than just being sad.
Elle is not alone. One study found depression and anxiety symptoms in children have doubled compared to pre-pandemic estimates.
All of a sudden, the world was sort of closed to you. And that led to a significant increase in depression and anxiety symptoms for teens.
One of the more troubling trends, suspected suicide attempts for girls ages 12 to 17 were up nearly 51% in 2021. Elle was hospitalized multiple times in the past 2 years for suicidal ideation and attempts.
The anxiety, depression, suicidal thoughts, all of it was all spilling out, and I couldn't keep myself safe.
Elle's mother, Amy, struggled with how to best help.
Because of the stigma, the system really isn't set up to make things seamless, right? You have to do a lot of fighting and a lot of advocating and a lot of looking on your own.
A coworker connected Amy to the National Alliance on Mental Illness, or NAMI, a nationwide organization that offers free mental health services and peer-led support groups and programs.
We're not born knowing how to deal with mental health challenges in ourselves or in our loved ones. But there's help out there, and you don't have to go through it alone.
NAMI says calls to its New York City helpline increased 200% over the past 2 years. Experts say key signs parents should look for in their teens include isolation, a lack of interest in extracurricular activities, not wanting to engage with friends, and substance and alcohol abuse. Elle says they're now doing better. Amy and Elle's advice?
If your child is telling you how they feel, to believe them and to trust them.
The first step is really hard and really scary, but once you take that first step, that leap of faith, it slowly gets easier.
Karen Travers, ABC News, Washington.
And our thanks to Karen Travers for that report. And now the government is releasing new and revealing data about just how widespread the issue of mental health is among high school students. The CDC reports that just last year, 44% of kids reported feeling persistently sad or hopeless. And more than 55% reported emotional abuse in the home. ABC's Ann Flaherty joining us now with more. I hope I got those numbers right. And if not, you can call me out here. It said actually 44% of kids reported feeling persistently sad or hopeless, and more than half, I see, of that number, 55% reported emotional abuse in the home. A lot of numbers, a lot of percentages. Bottom line, it's not good, and something needs to be done clearly moving forward to work with our teens. So what stood out to you in this report?
That's right, Kira. I mean, these were dispiriting numbers. I think most of us knew that this was obviously an issue during the pandemic, the mental health of kids. But this is the first study of its kind. CDC looked at 8,000 kids and asked them more than 100 questions. And this was in the spring of 2021, after most families had been locked down for about a year. And what these kids reported was that they persistently did feel sad. The kids who fared better were the ones that felt some sort of connection to adults and connections to schools. The kids who fared worse, LGBTQ kids, a stunning figure, 3/4 of them reported abuse in the home. And when they lost those connections to the school, they fared worse in the pandemic.
And, so the pandemic really contributed to all of these mental health issues in so many different ways. And that's interesting what you bring up about these students feeling comfortable at school. We talk about bullying and kids having a harder time at school, but we've done so many interviews, and like you said, we've gone to a number of studies that say actually schools where a lot of these kids feel safer sometimes than their home.
That's right. And the CDC study actually came up with some recommendations that schools can keep in mind. They talked about setting up programs for social and emotional learning, teacher training, making sure that discipline is even and fair across racial and ethnic lines, so that certain kids aren't targeted in that. And, you know, we talked with one of the researchers, they talked with reporters today, and they said something I thought was very powerful. They told reporters, you know, if you make the school less toxic for one group, you make the school less toxic for everyone. So really those programs that schools can put in place, not just political correctness, there's the data now to show that they actually work to help kids stay healthy.
Yeah, now the goal is just to make it happen, get those schools to implement those tips. Ann Flaherty, appreciate it. Thank you so much.
Thanks, Kira.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.